Good afternoon and welcome back to the Industry 4.0 and Sustainable Supply Chain stage here at CogX. I am Kat Skeely. I'm the CEO of Beep and founder of Frontline.live, and I am your MC for this stage for this last but absolutely not least session. It has been the most fantastic, and there's been some incredibly insightful conversations over the last couple of days. And I'm expecting this last session to be even more fascinating. We're going to be talking about the one thing that is really the most important thing of all for all of us right now. We're going to be talking about how can unlikely players work together. We're going to be talking about public and private partnership. How can we get vaccines to all parts of the world, including the very poorest parts? How can we harness the power of big data to understand who needs what, when? How can we immunize the earth? So with that, I'm going to hand you over to Hélène Stanway, who is the digital leader at AXA XL.
Hi, everybody. Thank you very much for that intro, Kat. I am super excited to be here. Really looking forward to talking about this very topical subject. So yes, as you said, the title is Immunizing Earth, the Challenge of Distribution. How do we distribute equitably these life-saving vaccines, both what we're calling the traditional, as well as obviously what we're all going through now, which is how do we then do that for COVID? I have got three fantastic panelists who will introduce themselves shortly. But I'm Hélène Stanway. As Kat said, I lead digital at AXA XL. So a little bit of a spoiler. Why is an insurer in this conversation? You will find out later. But actually, it's a really sensible grouping of people to help solve this problem. So let me hand over to Mike to introduce himself. Mike,
hi, everybody. It's a pleasure to be here. Thank you for having me. This is Mike Cantrell. I'm the data science manager at Parsyl. And just to give a little background on Parsyl, Parsyl's a tech startup that was founded on the idea that data can improve reliability and availability of vaccines in the developing world. Today, both in the global health space as well as the private sector, our IoT supply chain data platform helps shippers understand, mitigate, and ensure risks to their sensitive goods as they're shipped and stored around the world. Thank you.
Great, thanks, Mike. Walter, over to you.
Hi, everyone. Thank you. My name is Walter Kerr, and I'm the Global Director for Emergency Response at Zenysis Technology. Zenysis is a big data firm, also a startup. We're based in Silicon Valley, but work everywhere but. We work in more than 10 countries, including in Latin America, South Asia, Sub-Saharan Africa. And the big problem that we solve is taking any number of fragmented information systems. This can include supply chain systems, health systems, financial management systems, population data, census data, et cetera, bringing them all in together into one unified platform so that decision makers can make more targeted decisions about where to allocate vaccines, where to allocate health commodities in a data-driven way, so that ultimately we can improve health outcomes in the countries where we work. Very excited to be here today.
Fantastic. And the wonderful Seb, over to you.
Hi, Helen. Hi, everybody. Really delighted to be here also. My name is Seb Meany. I am head of UK strategy at Gavi, the Vaccine Alliance, in our resource mobilization, private sector partnerships, and innovative finance team. A little bit about Gavi for those of you who don't know who we are. We were established 20 years ago to bring new and improved vaccines to the developing world, essentially to drive down the numbers of under 5 mortality, the numbers of children dying. 20 years on, I'm delighted to be able to tell you that we now reach around half the world's population of children with new and improved vaccines. We also make sure that there are global stockpiles of vaccines against epidemic outbreak potential. We work in around 60 low-income countries around the world, so we're really trying to reach the people who are the hardest to reach often. And that's why I'm delighted to be able to have this conversation with you and with the panel today. Back to you, Helen.
Fantastic. So in good tradition, we've got some pre-prepared questions. Can I just say as well, I mean, a huge congratulations, Gavi, to the fundraising initiative that you were successful in at the end of last week. That is such a boost to be able to continue that fantastic work. So well done on that. That's truly impressive.
Thank you, Helen.
So let me take you to 2016 in Davos. You launched Infuse. So that helps obviously improve the delivery of vaccine systems, connecting high impact innovations and countries. Can you tell us a little bit about what that Infuse program is and how it's helping to address the challenges of the distribution of vaccines? I think that one's for you, Seb.
Yeah, thanks, Helen. So to unpack Infuse, it's a nice catchy title, but what it stands for is Innovations for Uptake, Scale and Equity in Immunization. One of the key components of vaccine distribution is first that they need to be kept cold. So they need to be kept within a certain temperature range, normally between 2 and 8 degrees. They need to reach the patients that we want them to reach. So, you know, depending on the schedule of that particular vaccine and the age range, then we need to make sure that people know where and when to get the vaccines. We want to make sure that they're cold and they've been kept cold throughout the chain so that they are potent. We want to make sure that the data is coming back such that the planning for the program is done as efficiently and effectively as possible. And we want a logistics and supply chain that really reaches out as far as is possible to reach out into some of the more difficult parts of the world to reach children and families. So it was really set up to look at proven innovations that perhaps had been used in other sectors. We're not talking about, you know, technologies that hadn't been proven elsewhere, but which could be brought to bear and address some of these challenges and bottlenecks that we see in immunization, which are tough nuts to crack. But we genuinely believe that there are certain technologies and certain approaches that we can take from other sectors, be that public or private sector, that we can apply to address some of these issues. And, you know, two of the speakers on the panel here, Mike and Walter, are part of that, what Infuse program, so-called pace setters. And so every year we've set forward a challenge. We've received applications to address that challenge. We have filtered that through various panels and groups of experts to then identify and work with pace setters. And we then take those technologies to countries to help those countries address those specific bottlenecks. And ultimately what we want to achieve with the program is to give those countries with which we work and those ministries of health with which we work a better choice, more choice. Currently, much of where we work is still pen and paper. It's still relatively basic, and we think we can potentially use this program to leapfrog and move forward much more quickly than we might otherwise do.
Fantastic. Yeah, it's a really, really sort of complex and vast ecosystem, actually, because, you know, every country is different. Every country is set up differently. They have different levels of, you know, technology advancement. So it's really interesting, kind of your comments there around that kind of 2 to 8 degrees. And actually, one of the key points that we need to get to is to make sure that those vaccines are potent so that they are kept within that 2 to 8 degrees. But from conversations that we've had, actually, we don't know that that's the case today, because there isn't that kind of systemic use of sensors in order to capture that data. So you know, it's a bit of a dark data zone, pen and paper. So it's great to see, and I will hand over to Mike to kind of to explain more. But it's fantastic to see actually that we've now got these new technologies that can help start to answer those sorts of challenges. So Mike, do you want to tell us a little bit more about the work that you've been doing in Gavi supported countries and how these tech changes have helped improve the supply chain there?
Yeah, absolutely. So as both Seb and Helen mentioned, keeping these vaccines in the right temperature range is critical for their efficacy before they're administered. And Parsyl's IoT sensing device is constantly recording data on the environmental conditions experienced by sensitive goods as they're either shipped or stored. So since 2018, when Parsyl, with the help of Gavi and the Pacesetters program, launched pilots with the Ministries of Health in Senegal and Uganda, we've collected over 15 million temperature data points on vaccines. And in Senegal, we're covering 55% of the supply chain, and that should be 100% soon. So, our early work shows that a low-cost, high-tech solution like ours can really improve immunization delivery through data visibility, as you both mentioned, and also risk mitigation. To paint a little picture, as you both mentioned, I mean, the status quo when we arrived was healthcare workers with pencil and paper hand recording temperatures. And you can imagine in a large country like Senegal, pencil and paper scattered across hundreds of health facilities. It's hard to use that data, right? So because our devices are constantly recording temperature and automatically sending that data to healthcare workers' mobile phones, that means in terms of data visibility, there's easier recording, there's easier access and navigability, the data is centralized. It's also higher resolution and higher fidelity. So I can speak to a little bit of the impact that just empowering a country to see their own data has. We've heard from our users in Senegal that there's a monthly district level meeting for the vaccine supply chain, and that the Ministry of Health has become much more data forward or data driven since working with a technology solution like Parsyl. So those monthly meetings now actually have a period where they look at our web app and they review the temperature data for their vaccines. Another story, we heard from a regional manager who was reviewing their data on the web app. Again, imagine how difficult this would have been, right, with pencil and paper. But they were reviewing, a long history of their temperature data at different facilities. They found a refrigerator that is routinely out of temperature spec. So they called a healthcare worker at that health facility, had them validate what they saw on our web app. The refrigerator was misbehaving. So the regional manager identified a nearby safer refrigerator, had the healthcare worker move those vaccines to the safer refrigerator, and ultimately had the refrigerator replaced. You also just can't undersell the value of giving people their time back. We heard from a nurse that she was recording 3 times a day, 5 different refrigerators' temperatures on pencil and paper, and now that's automatically on her mobile phone, so she has time to actually do her job. So yeah, I guess to summarize, ultimately we found that a tech solution like Parsyl's can empower a country to shine a light on their own data dark zones, to see their data and to be able to take action on that data. And I guess in the wake of what we're all aware of right now with COVID-19, the pandemic, having sort of visibility into supply chains is going to be even more important.
Yeah, no, that's great. Thanks, Mike. And I love your background. The painting behind you, I think that says it all really in terms of what you as an organization are trying to achieve. So that's fantastic. Let me jump to Walter, because you've got some fascinating stories around kind of that big data picture actually, and how you're looking at all sorts of different stories. So tell us more on that.
Sure. Well, I agree with everything that Mike just said. And when you're looking at a very complex environment, when you're thinking about how do I administer an entire country's vaccine distribution program, there are so many things you need to think about. The temperature monitoring piece is essential. In the context of a humanitarian situation or an emergency response situation, things get very complicated. in terms of thinking about where do I need to allocate vaccines, when, where, and how. And so the big problem that we solve is around this, this challenge of rapid integration of any number of information sources, so that decision makers can make these kinds of decisions about how to run and administer their supply chains. And so one component might be the temperature monitoring data, but there are also so many other factors that decision makers need to take into account, such as what does the disease burden look like in a particular part of the country? Is there a workforce available in that particular part of the country that can even go and administer the vaccines? What does existing inventory look like? Are there expiring products on the shelf? Are there about to be stockouts? There are so many questions, and each of these questions can be traced back to a different kind of data source. But one of the biggest challenges in global health and in terms of supply chain management is, how do I actually bring all of these information sources together so that you can make a data-driven decision? And so the reason I mentioned the emergency and humanitarian response piece is because I think one story that I think highlights why being able to use all of your data all at the same time, that really highlights why this is so important. It relates to the work that we did last year in Mozambique. As many viewers, I'm sure, remember last year, Cyclone Idai hit Mozambique. It was the largest cyclone to hit the African continent in more than 25 years. And overnight, what happened was we saw hundreds of health facilities that yesterday were churches and clinics were now all of a sudden taking in patients. And we're using all sorts of different types of tools, ranging from Excel to mobile apps, to collect data about the number of people who are coming in with cholera, with malaria, with injuries, et cetera. At the same time, you had this rush of international actors, from UNICEF to the WHO, to the CDC in the United States, also going to support the government, on top of all the Mozambique government agencies that were involved in the response. There was this proliferation of data, and the government needed to make decisions about, where do I allocate the emergency vaccines that have been made available to us, with Gavi's support, by the way? Where do I allocate those vaccines to the places that need them most? And so the role that we played was to rapidly integrate all of these information sources all at once: supply chain data about health information coming from these 154 plus health facilities from international partners, so it could feed into one centralized nerve center of sorts. So the government could see very clearly where they had upticks in reports of cholera, where they had infectious disease outbreaks, where they had potentially contaminated water sources, so that they could direct in a very data-driven way where to allocate emergency stockpiles of vaccines, where to target water treatment activities, et cetera. And so if there's just one point that I would want to leave you with in terms of thinking about how to think about vaccine management or supply chain management or health policy, it's that really, when we have the benefit of being able to see data in the context of other data, when we have the ability to bring in multi-sectoral data together, we can make very data-driven decisions that really have tangible outcomes in terms of improving health of populations. And so in the case of Mozambique, they were able to use this data to turn the number of new cholera cases per day in the most affected province from 400 new cholera cases per day to 0 new cholera cases per day in just 3.5 weeks. I think that's a pretty amazing story and victory for the Mozambique government.
Wow, what a powerful story that is.
Yeah, really amazing, Walter. Can I just second that? That was, I think, one of the collective humanity's best responses to a really awful cyclone with so many people in dire straits, and particularly the cholera numbers you talked about, how well and how quickly that was controlled. And I think you played a good part in that. So yeah, I just want to recognize that story. That was amazing.
Thank you. Yeah, I mean, we played just one part in it. I think that's an important part to point out. The government really was in the driver's seat, and giving our partners the tools that they can use to inform effective decision making is really the most important thing that we and others can do.
Helen, I'm curious. You're moderating our panel, but you work for a marine cargo insurance company. part of the AXA group, and you mentioned unlikely players up top. Why are you here? Why is it important to bring this this cross-industry collaboration? I'm curious. Tell us, please.
Great question. Thanks, Seb. So I think I would echo a lot of actually the themes that have already been brought up today. We talked about data-driven decisions. We talked about we've actually talked about both the enormity of data that's out there as well as the vacuum of data that's out there. And actually, the insurance industry must respond to this and the need to be able to provide the right insurance products to be able to help, safeguard, replenish, pay for the replenishment of vaccines as either they lose potency or get lost, throughout that cold chain. But actually, at the heart of the insurance industry is more risk management, actually. So how do we help support the industry in a traditional sense, as well as in the future or even the now world of looking at kind of sensor-enabled data? So where insurance plays its part is in that risk management sphere. So looking at the end-to-end cold chain, we've used that term, and where are those pinch points where risk can be improved? Because actually you want a prize for something not happening, because nobody wants loss. You want this chain to operate smoothly. So how can we as an industry provide that insight, that advice, both in a traditional manner, because, they may be not the most exciting things, but standard operating procedures, how things are handed off, how things are organized in manufacturing sites, making sure that, sprinklers are there, sprinklers are operational, all of these fundamental things that help keep this whole supply chain going. And insurance and risk management underpins all that. And actually, that's why it's so exciting with the work that Mike and Walter and yourself are doing to move that data piece forward. Because at the moment, there doesn't exist, as far as I know, an insurance response to vaccine potency, because we just don't have that data. But when you look at the data and you say, actually, definitively, this has stayed within that 2 to 8 degree, temperature threshold, you have that clarity that the vaccine, given those guidelines, is potent when it does go into a child's arm. And where it's not potent, actually we can then respond by replenishment and through all of those data stories, making sure that the inventory's there, and as I say, the supply chain is there, so that we can actually, make it better as fast as we possibly can, because we can respond quickly. But I would say, it's been an absolute delight working with you, and we've got some really, really exciting, ways that we can help move forward. But I would say it's probably the most complex problem I have ever come across, because there's areas where there is no data, there is a bunch of data, there's new technologies, there's a whole bunch of private and public partnerships. There are several concurrent supply chains as well, actually, which all need to be monitored. So you're needing to supply the glass for the vials, the needles for the vaccines, never mind the actual vaccine itself. So it's hugely, hugely complex, and delighted to represent the insurance industry. And there are several of us helping with this problem. So we're all responding, which I think is fantastic. So yes, exciting times to have us unlikely players working together.
Indeed, and I think, and Mike can probably talk about the fact that it's not just about the kit and what it consists of, but I think in Uganda, Mike is part of a project where the vaccines need to be delivered to fishing communities on islands. So it's not just, the way you would think about an ordinary supply chain. Now we're also talking about boats and keeping the vaccine cold and making sure that that sensor is with that vaccine, so that when it gets to the fishing people on an island 3-hour boat ride away, that those children are getting those potent vaccines. So I'm just trying to paint a slightly broader picture here of some of the challenges that we collectively are trying to tackle, and the kinds of places in which we work, which, as you note, Helen, is is more complex than you'd perhaps appreciated when we first met. Back to you.
Let me just pick up on a point from sort of the data point and how artificial intelligence and machine learning are being applied, because obviously you've got the data, but actually how are you looking at those particular facets, and also having a look at I think what we're calling the tale of two vaccines. So how do we look at the traditional and how that's going to alter and pivot based on how we respond to COVID? I don't know, Walter, do you want to take that one first?
Sure. I think one of the things I think that's really important, a really important caveat to always put out there when we're talking about what's possible within the world of artificial intelligence and machine learning, is that one size does not fit all. Every country is different. Every country's data quality is very different. Data can also misrepresent things. So if you have certain population groups that are that consistently show up to health facilities, and you have other particularly key population groups, maybe vulnerable groups that do not go to health facilities for whatever reason, and you develop machine learning models around that, you're going to end up developing forecasts that might tell you things that obscure reality or can bias towards one group or another. So I just want to provide some important caveats around machine learning to say that it's not a panacea to solve all problems the way that I hear sometimes people talk about it. Having said that, I think machine learning applications can be very useful in the context of things like looking at vaccine distribution, anticipating, forecasting future disease incidents so that you can pre-position resources, et cetera. One of the things that we're seeing right now in the context of COVID is in all of the countries where we are working, we are seeing service delivery for every program affected. So you'll see fewer people going to health facilities, for example, because they're fearful of potentially contracting COVID. That doesn't mean fewer people are getting certain diseases. It means that fewer people are likely going to health facilities. And so we're seeing fewer reports. We're seeing supply chains affected, so that we have fewer or more limited ability to deliver vaccines or to deliver drugs to some of the communities that need it most because of quarantine policies or lockdowns, et cetera. And so one of the most interesting applications I think that we can do right now in the world of machine learning and artificial intelligence is do things like forecast under normal conditions, what would the expected incidence of a given disease be as reported, as we would expect in normal times versus what are we seeing right now, so that we can measure that gap in terms of where are we likely missing kids who need to be vaccinated. Where we can identify the communities that are being most affected as a result of COVID, in terms of the indirect effects of COVID on other diseases, we can then think about creative new ways that we can design interventions to try to get to those kids who need to be vaccinated. So this is just one application of using machine learning. It's to forecast expected incidents or expected morbidity, mortality, et cetera, against presently reported data, so that we can rethink how it is that we're doing interventions for those places that are most affected. But there's actually a whole range of ways that I think you can use artificial intelligence and machine learning to address or improve vaccine delivery. In the context of COVID, this is one of the requests that we're seeing most frequently from the countries where we're working.
Yeah, wow, that's fascinating stuff, isn't it? And it's, it's really interesting as we look at kind of how we can forecast that supply and that inventory, which is such a big problem today, and to make it much more precise to what we need and avoid sort of overstocking and such like. Mike, did you I think you had some stories on this as well, in terms of kind of how this is operating.
Yeah, absolutely. What I mentioned earlier was really around just data visibility and access, and that's critical. It's a critical first step, having the data. But as a data science practitioner, what I'm most excited about is taking the next step and extracting value from that data using machine learning to empower people to with actionable insights. So at Parsyl, we're really interested in finding patterns, uncovering trends to try to improve the supply chain by predicting performance and risk. I think at Parsyl, I'd like to bucket the sort of machine learning tools into 3 buckets for the global health application. So the first is really around like the point in time of delivery of a vaccine. So our device is really special in that it works in a no connectivity environment, right? It's along with the goods, it's collecting data on the temperature, and it is in real time updating its belief about the efficacy of the vaccine. So when a nurse is carrying a carrier of vaccines to a rural area, for example, when she opens that box and is about to administer that vaccine, our device can actually alert the nurse that the vaccine may not be effective. Our device has sound and light that can emit. So that's sort of like the point in time intervention. The second bucket is around intervention. So I already mentioned the example of the regional manager replacing the refrigerator. This is making real-time changes to the supply chain to optimize for outcomes. Another example is our device is capable of making smart alerts to sort of resolve a problem before it becomes too thorny. So for example, we're able to know when a refrigerator door has been left open, or a box of vaccines has been left open, or a box of seafood has been left on the hot tarmac at an airport, and again, alert people to fix the problem before it gets too big. But the most exciting in terms of machine learning is the third bucket, which is around prevention and prediction. So our platform is able to help shippers of sensitive goods understand, if I'm going to ship this particular good at this time of year, what are the best shipping lanes? What's the best packaging that I can use? What's the best third-party logistics company that I could use to optimize for the quality of the outcome? And we're also able to make suggestions, right? If you change this packaging, add an extra ice pack or something like that, we strongly believe that the outcomes will be better. And I think the last bit that's really interesting is having a sort of data trail. So in the past, the mantra was really ship and pray. You'd put your sensitive goods in a box and you would ship it, and you would hope that the person who received it opened it and was pleased, or that the vaccines were effective. And if they weren't, you wouldn't know why things went wrong or when or where. And with Parsyl, since there are devices with the goods through the entire journey, we actually have a paper trail or a data trail, and we can identify, when and where things went wrong, potentially why they went wrong. And, the point is that we can really prevent this from happening twice. We can learn from our mistakes, and we can get smarter with every shipment.
Yeah, I think, and we've worked with you guys for a little while now on some of those use cases outside of vaccines, and that's absolutely, core to kind of that risk management of, I love what you said there about, shipping lanes and new forms of packaging, and it's all about that prevention before it happens, and then alerts as it happens to be able to keep that supply chain going. So it's a great partnership with sort of data and insights and so on. So talking about kind of those insights, what are your thoughts about, how that data can help governments, international organizations to kind of improve that reach and impact of vaccines?
Yeah, that's a great question. On the government side, I think, it's really mostly around understanding and finding the most cost-effective ways to mitigate risk. So there's some really simple insights that we've found that are actually very valuable, right? So for example, we found in one area that 55% of the damage done to vaccines by refrigerators, where vaccines spend most of their time, is done by actually only 5% of those refrigerators. So this shows, just if you know that and you know which refrigerators are misbehaving, the value of targeted intervention is huge. We're also building machine learning models to predict refrigerator health and when they're going to stop being effective, so that supply chain managers can get ahead of that and have replacements and replace them before they start to really do a whole lot of damage. We have a large amount of empirical data on refrigerators in the wild. So we're able to sort of scorecard those and provide information on which is the most effective in different situations. And another example of just like a simple insight that's actually incredibly useful is we found that different stages of the vaccine supply chain are most sensitive to different types of exposure. So both heat and cold are bad for vaccines. And depending on this stage of the supply chain that the vaccine is in, we found a very strong signal, a very strong trend that one is much more likely to do harm than the other. So it's, again, the targeted intervention piece. But you asked about the private sector as well. So on the sort of other side of the house at Parsyl, we work with suppliers of sensitive goods like seafood, cocoa, or coffee, which are sensitive to temperature and humidity. And what we're starting to realize is, as you mentioned earlier, Helen, is that risk management and insurance are really two sides of the same coin, right? So we were working with suppliers and they were telling us that they were having a really hard time finding, frankly, useful insurance. It was both affordable and actually targeted at their needs. And we spoke with insurers like yourself, and they told us, well, we know nothing about these risks. We have to, in the light of complete absence of data, these are the rates that we have to write to be able, if we had more information, we could actually do something about it and write affordable insurance. And so from this, Parsyl's really emerged as a conduit between the two parties, between the suppliers and the insurers. And we've sort of developed a data ecosystem where both parties benefit from having data, visible, high quality data. And what makes me personally and Parsyl in general feel really good is that we feel like interests are aligned, right? Both parties are looking at this data and both parties want to improve outcomes and to reduce waste. If we have time, we can come back to it, but Parsyl recently launched insurance products of our own. We are an insurance company now, but working with one insurance company before our launch, they had us work on risk management for one of their clients, a major supplier of cocoa, and we monitored their cocoa shipments for one season. And like you mentioned, made recommendations on risk management around packaging and humidity and various shipping lanes. And the subsequent year after our study with them, the insurer reported that their loss ratio went down by 25% for that particular supplier, which is that's significant. We're really proud of that. And I guess to bring it full circle back to the global health space, we're starting to hear more and more, as you were alluding to, Helen, that on the global health side, people are starting to be interested in this idea that risk management and insurance are really two sides of the same coin.
Yeah, no, it's a fascinating journey, and it's so exciting to see these technologies, improving that situation. I go back to that point of, you don't get a prize for something happening, but we all want that, in inverted commas, prize, because we don't want this stuff to happen. We want to be able to predict, prevent, and so on. But Seb, just on that sort of same question, kind of how is all this data that you're getting from these sources helping you as Gavi make different decisions, better decisions, because of the inputs that you're now getting?
So I think it's relatively self-evident from Walter and from Mike's responses that this data is useful for Gavi, but we exist to support ministries of health. And what really matters is that the healthcare workers, the ministries, the planners, the directors of these particular parts of the ministry are able to use the data, that it is meaningful to them, that they are able to plan better and be able to avoid and prevent what they can. But equally, there are things that are unavoidable, and to be able to plan better, having that prediction, the predictability that some of this data starts to give. So what we're trying to do is to help countries to improve their supply chains broadly, from kind of procurement to patient. There's a whole set of interventions, and the more data we can bring to bear, the more we can support both our own use of public money and private money, which we use to buy the vaccine, so we can use that money as efficiently as possible. But most importantly, to hand over to countries a set of solutions which help them to perform better. Because at the end of the day, when we talk about risk management and we talk about prevention, what we're in the business of is preventing unnecessary mortality. Now, 1.5 million children still die every year from vaccine preventable diseases. And that's something that drives us forward. That is our mission. We try.
Okay, let me bring the human back in. So we've only got 3 or 4 minutes left. So the human is obviously key. So I love talking about technology, but actually there are lots of cultural things that can be improved. And there's actually how do we create that culture within us as human beings, where we can look at this data, where we can manage those relationships. And let me give you one example. Is how do we, very specific to us as an insurance organization, how do we continue to drive that risk management culture? Because it's obviously humans that then have to go in and replace the fridges that we've articulated, that then has to sort of execute on the vaccines and so on. How do we bring that human back into the equation and have that relationship between the data, the technology, and the human? Maybe Walter, if I can throw that one at you to start with.
Sure. I think there's a couple of ideas that I would want to highlight. First, I think that there have to be feedback loops. So we have a lot of people who are out in countries, going out, and we see them collecting data and feeding that data up. And that's very useful for decision makers at central levels to be able to make decisions. But for there to be real incentives to capture good data, people need to also understand how that data then comes back to them. So creating feedback loops so that people can see not just what they're sending up, but as the information comes back down, and how they can then use data at a community level, at a district level, to make decisions is really important. And the thing that I would add is that it's often not enough to just look at a single source of data. When you can look at other data at the same time, then you can make really much more data-driven decisions. So just as an example, if you're looking at just a supply chain system, for example, and you're looking at inventory levels, well, that might tell you that you've got a low amount of stock for a particular commodity. And that may or may not be alarming, depending on what's happening in health facilities in that same community. If you saw that at the same time in the past week there was a real uptick in a certain number of cases, well, you'll probably get to get on the phone and make sure that you've got enough commodities to fulfill all the needs that those patients will need. The point here is to say that we need to be doing a better job of getting data up and then data back down to the point of care, to where people actually need to interact with the data and make decisions, and then also give people the benefit of seeing other types of data so that they can make even better data-driven decisions, and really being partners in terms of thinking about not just collecting and analyzing data, but how do we actually then use data to improve health performance around the world.
Yeah, I couldn't agree more with that feedback loop, because it's that feedback loop that helps, change behaviors, make data-driven decisions to kind of improve the whole chain, actually. So we've got 1 more minute left. Any parting words before we take a break, before Q&A, that anybody would like to jump in on, any important points we might have missed? No.
I might want to just amplify a point that you made at the very opening, which is that we're not the only ones that can solve this. It's not just Parsyl. It's really all of us that need to come together and to work together. You had started this conversation with this idea of unlikely partners coming together, and I think that one of the best things about the Infuse program that Gavi has set up is it's an opportunity to bring the best of the private sector to really the world's most challenging problems, so that governments and the private sector can work together to bring the best of both worlds to really save lives in the end.
Yeah, for sure. I mean, I'm a firm believer that collaboration, that diversity of thought coming together as different groups of people is really what makes the difference. and being action oriented off the back of that. So yeah, no, it's been a great partnership, and long may it continue. Great, thank you very much, everybody. I think we are closing, handing it back to Kat maybe before we have a break.
Thank you so much, Helen. That was a brilliant session and a perfect end to a phenomenal few days of learning. So what are my takeaways? Well, we are in the most exciting time in human history. We understand more about how the human brain works every day. We've got massive and affordable data and pervasive technology that allow us to understand social behaviors and interaction and interdependencies in unprecedented ways. We're more connected than ever. We've got all of the pieces of the puzzle to head towards a people-centered, people-powered, sustainable future. But we're at a crossroads. Change will accelerate. We need to set up resilient systems so that we can respond rapidly to unexpected challenges and to make the most of those mountains of opportunities that appear around these unexpected moments. We have to bring all of the pieces and the players together, public and private. Policies need to evolve to be fit for purpose in the connected world. The right data needs to be collected, aggregated, analysed, shared. And we need to make sure that the right people can see what's going on and that they have the right technology so they can make not data-driven, but data-informed decisions. And we need to keep front of mind that no change will happen at all. People will not partner. Mindsets, behaviours will not change. Organisations will not collaborate unless we can build trust into the DNA of the way we work, into our cultures across public and private. And let's not forget, everything can be better, always. So thank you again, Helen. Fantastic endpoint to this journey that we've travelled together over the last few days. I really hope that you've enjoyed it as much as I have. And with that, I'm going to hand you over to the Q&A, and I'll see you next year.
Want access to more CogX videos? Subscribe now for free at cogx.co.